case has got fractured nasal bone, but pre-operatively, I seen the patient's photograph. He doesn't have much deformity. Little bit C-shaped deviation of the septum of the toss of the nose. Otherwise, there is no depression of the nose. So what we have decided, and because there is some swelling, we are not going to do formal growth reduction under GA. We will be giving a nasal plaster without anesthesia because patient is very cooperative. He will not need any nasal splintage because there is no history of bleeding, and we are not going to do any procedure, so there will not be any bleeding also. So only nasal plaster. And if I am going to press here after giving the plaster, his nose is getting straight. So this is what I will be doing after giving plaster. We'll give this plaster for 7 to 8 days. Remove the plaster when the edema settles down. We'll ask the patient again. If deformity still persists, we'll go for formal reduction. If he's happy with the shape of the nose, no further treatment required. So what we need, we have already dried everything here. Okay, I close these eyes to protect the eyes so the plaster of Paris should not go into the eyes. Okay, and we applied little tincture benzoin so that the micropore will stick nicely. What we have done here, this is actually autoclave instruments called as ash and Walsham sources, but because we are not going to reduce it, we are not going to use them. And different lengths of micropore strips are cut, different lengths and different lengths of the POP strips. Because molding is better with multiple strips. Some people do single strip method, but molding is not good. So tincture is applied, and now we are going to put micropore tips first and plaster on top of it. So after we have put this micropore tapes in different shapes, now we are using this plaster of Paris strips. Okay, different lengths as per the length of the micropore what applied. So we can go oblique also, oblique, horizontal, long and short strips. So this is a wet plaster of Paris. So we are going to apply like this. The main idea, your plaster should not go into the eye of the patient, otherwise it causes lot of irritation. That is the main thing.